I'm going to perform a manual muscle test of the elbow flexion. So first of all, the client is seated, the arm is going to be relaxed and supinated. For stabilization, I'm going to stabilize ipsilateral shoulder. First, I'm going to do a screen test. So good. Next, I'm going to have a client go through active range of motion while I'm palpating the bicep brachii. So I'm going to have you bring your hand up, facing up, and bring the hand to your shoulder. Go ahead. As far as you can. Good. So next, I'm going to apply pressure, resistance to the arm into extension position. So I'm going to pull on your arm. I'm going to say ready, set, go, pull, and we're going to do 3 holds and then relax. Okay. Okay. Ready, set, go. Hold, hold, hold. Good. So you can relax. So the client performed on a grade 5 normal. I'm going to perform a manual muscle test of the shoulder flexion. So the client positioning is seated, arm is relaxed. I'm going to stabilize the ipsilateral shoulder. I'm going to palpate the anterior deltoid. So first we are going to get into the screen test. So I'm going to have your elbow straight. I'm going to don't resist it. I'm going to stabilize the shoulder. We'll go into the screen test. Good. So next I'm going to have you do the same motion while I palpate the shoulder. Go ahead. Can you go more? Okay. Go ahead and relax. So since the client is not able to perform an elbow flexion, the shoulder flexion, we are going to change into the gravity eliminator position. For the gravity eliminator position for the shoulder flexion, the client is going to be positioned on the contralateral side of the shoulder that's being tested, with the arm that's being tested straight out. So we're going to go full range of motion. So when I stabilize, I'm going to stabilize in the same way. I'm going to stabilize the ipsilateral shoulder. I'm going to palpate the deltoid muscle, and the difference is the client is going to now slide the arm into the flexion. So you'll be able to do this. No. Okay, so first I'm going to do the screen test. So first, let's see where we can go. Cool. Now I'm going to have you do the active range of motion as well. Same thing, but you are doing it now. So go ahead. All the way. Nice. And go ahead and relax. Good. All right. So the client was able to perform active range of motion in the gravity eliminated position. So we can grade the client at 2, which is poor, just because the client was not able to perform this in the gravity in the position with the gravity. I'm going to perform a manual muscle test of the knee extension. Go ahead and bring your leg forward. Good. So the client position by sitting down, I'm going to first stabilize. The stabilization is going to be at the hip, so I'm going to keep my arm at the hip. I'm going to palpate. Go ahead and bring your arm down. Going to palpate the quadricep muscles for the knee extension. First, I'm going to do a screen test to see the range of motion, passive range of motion. Okay. Next, I'm going to stabilize. I'm gonna have you, while I'm palpating, I'm gonna have you kick the leg up and hold it there for a little bit. So go ahead and go full range of motion as much as you can. Okay, go ahead and relax. Alright, so the client is not able to perform full range of motion actively, and I don't feel much in the quadricep muscles, so we are going to change into the gravity eliminated position. So for the gravity eliminated position for the knee extension, the client is going to be positioned sideways, laying down. I'm going to stabilize the upper leg by holding it up. Then For the bottom leg, I'm going to perform a screen test first. So I'll put it into the flexion, then we'll extend it the way. Good. Next, we're gonna perform the active range of motion. So I'm gonna have you do the same thing. You'll put the leg into the flexion, then extension, and I'll be palpating the quadricep muscle. So go ahead and put the leg in the flexion and then extend it after. Go ahead all the way, and now extend it. Extend, 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 extend. Good. So the client was able to perform this active range of motion in the gravity eliminated position, meaning that the client is being graded at 2, which is poor. The reason for that is the client was not able to perform this active range of motion in the regular position. I'm going to perform a manual muscle test of the hip flexion. So the client positioned by sitting down, holding on to the chair with both arms. I'm going to stabilize the hip in the ipsilateral hip of the leg that's being used and tested. And I'm going to stabilize at the iliac crest region. So I'm going to palpate the quadricep muscles here, the proximal part of the quadricep muscle. And first I'm going to do a screen test by bringing the leg all the way up and here, flexing the hip. Good. Okay, relax. Next I'm going to palpate, I'm going to stabilize, and you will kick the leg up the same way we just did. Okay, go ahead. Good. Go ahead and relax. So next, so the client was able to perform the active range of motion. So next, I'm going to still stabilize the hip, but now I'm going to press on the distal part of the thigh, at the anterior side of the thigh. I'm going to put some pressure on it, and the client is going to be resisting this. So, and go ahead and do the same thing. Actually, I'm going to call it out. I'm going to say ready, set, hold, and I'm going to do 3 holds. Then that's how much you hold. So ready, set, go ahead and bring it up, and hold, 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 relax. Good. So the client was able to perform at the maximum contraction, so I was able to feel a lot of resistance, so the client can be graded at 5 normal.